If you suffer from pains in your neck, you are not alone. At least 10 to 20% of the people in the U.S. report feeling some sort of pain in their neck daily. Today, we're getting some medical answers on the cause and the best treatments. With us today is North Shore neurologist and pain management expert, Dr. Chad Domingue with the Avila Physician Network. Thank you so much for joining us.
Good afternoon. Thanks for having me.
Okay, so let's start off with what are some of the reasons that people have neck pain?
Yeah, just like in medical school, before we talk about how to treat things, you got to understand anatomy. And I think it's really important for our viewers to understand their spine. I have a normal anatomy here. This is a spine looking from the sides. This would be the back. This would be the front. I always compare spines to tripods. So front, weight bearing, back is the hinge. The hinge are these little joints called facets. They allow rotation. And the weight bearing is the bone in the disc. These yellow structures are our nerves, just like wiring, where we have to move things. So arthritis, herniated disc, bone spurs, pinched neurologic structures, numbness, weakness. These are the type of pathologies as doctors that we deal with when we're talking about cervical pain.
Okay, and are you talking about significant pain when we're talking about neck pain, or is it just a little something in the morning?
Yeah, so in my world, we're talking about incapacitating pain. And you can have bad arthritis, hate to turn my neck. You can have a bad disc, pinching on a nerve, causing radiating neuropathic pain down the arm. But we're talking about people with significant, not just a crick in their neck type of pain.
And what are some of the options before we talk surgery?
Yeah, so simple stuff, good posture, always make sure your eye level on your computer, core strengthening, Pilates, yoga, chiropractor therapy. You and I have discussed many times procedures I do, steroid injections, nerve burns, things like this, anti-inflammatories. But what we're really talking about today, Liz, is people with unstable spine, really severe pain. That's when you start talking about surgery.
Okay, so what is surgery? What are you looking at? The types that are available now, and will they cure the problem?
So the two most important things when you're talking surgery is, do you really need it, and are you seeing the right guy? Because you can see a really good surgeon that makes a bad clinical decision. So you have to have the two go aligned. What I tell patients is get surgery when everything else fails, and when you're having impingement of neurological structures. Getting surgery just for pain is kind of hit or miss. Surgeons can remove structures such as lamina, bones to kind of decompress. If a structure becomes unstable, then they move on to surgical hardware. This is an artificial disc that allows the neck to move in its normal spine. Depending on the pathology, this is good because it allows the normal movement, but it doesn't provide the stability of a typical cervical fusion. The problem with a fusion is God put everything here for a reason, and once you stabilize this, the segments above and below have to pick up the workload. Again, there's a lot of different surgeries, but it's really important that you make sure you talk to your surgeon. What are the expectations? Why am I getting this done? Have I exhausted every other option? I see way too many surgeries, and once you get it, there's no trade back. So you really need to have an understanding of what is the goal of the surgery.
Okay, so as we wrap things up, it seems as though you're stressing that before you even think of a surgical procedure for your neck pain, try those things first. And then even when you do decide to go to surgery next, there are those specific questions you need to ask, right?
Yeah, so just removing bone, what does that mean? Artificial disc that moves, am I a candidate for that? At Avila here, we have a robot that assists surgery. What's the benefit of using a robot versus not? It's a lot of questions, and I understand as a patient and consumer, it's mind-boggling. So you really need to have a good relationship with a physician that explains things very succinctly so you understand exactly what you're getting into.
Some very good tips as usual. Appreciate it, and hopefully it helps people deal, because neck pain is the worst. You need to be able to move your neck without pain. Okay.
You do need to move your neck, absolutely.
Thank you so much, Dr. Domingue. Appreciate it.